Everybody, welcome to our detox seminar here on Zoom. I'm so glad you're here. I'm Dr. Melody Billiot, and I have been in practice here in Marietta for going on 27 years. I work with all types of people and health issues to help them resolve chronic health problems when perhaps other procedures, drugs, and surgeries may not be the preferred avenue of which people would like to go down. So I love to help people regain their health. This program today is about detox. It's about prevention. It's about cleaning up after the holidays. And I hope all of you guys had good holidays. I know in our COVID craziness right now, everything's a little different and off balance, but we can still be healthy. And we can use this time to learn about our bodies and learn about what we need to do to actually keep our bodies as healthy and energized as possible. So we're going to talk a lot today about what is detox, what is a healthy detox, what does your body need to detox, and how we can actually do that safely. So let's get started. We're going to take questions at the end. We'll have a question and answer period. So hang on to your questions. If you do have something you want to add into the chat or our question, we'll be monitoring that and taking that down, but we'll cover questions at the end. So I'm going to go ahead and go through the program so then we can kind of take your questions and specific things at the end of the program. So let's talk about detox. Who should do a detox balance program? You may be thinking to yourself, I've heard of detoxes, lots of the things that are out there, the Whole30, a lot of things that people are doing. Are they healthy? Are they good for me? There's a lot of people out there doing keto and paleo, and what's the difference? And is it a detox or is it not? So we're going to talk a little bit about that and who should do a detox program. A lot of people who I work with are having some of these issues that you see here. Weight gain, fatigue, headaches, insomnia, sometimes digestive problems, sometimes some pretty major digestive issues, constipation, maybe loose stools, food cravings, can't think as clearly, can't remember, maybe foggy brain. So this program actually will address and basically the underlying root causes of some of these symptoms. If we look at the detox balance that we're going to do here in our body, that's exactly what we want to do, is we want to balance the body. The body's self-healing, it's self-regulating, and when obstacles to healing are removed and the body's properly fed, then we can be well. And these are the things we can achieve. We can have better circulation. A lot of times we'll sleep better. I had one patient who did this program and her sleep was terrible. And a lot of times we don't really think about this, but sleep has to do with our digestive system, has to do with our gut. And this detox program is very specific in helping our body's digestive system be as healthy as they can be. And a lot of times in doing that, we'll absorb the nutrients we need to get good sleep. And sleep is what helps us heal. So you see this pattern. Sleep well, body can heal, we can rebuild and regenerate. Hormone function can start to normalize. The liver plays a huge role in eliminating excess hormones from the body. Increased energy, overall health, hair, skin, and nails, all the things that we really want to look good. A lot of people will lose weight. Reasons why people have weight are things we do in programs here at my office, and a lot of you guys who are patients, we've talked about this. Where does weight come from? How does weight loss occur? How do we get back into those skinny clothes again? Weight is generally a indicator of health. And if our health is not good, generally the body's going to hang on to this weight. So improved digestion and elimination often is a pathway towards achieving that weight that we want to have as well. Reducing allergies, headaches, joint pains, muscle pains, all of these things can be achieved when we have better health. It is in many, many cases all about our hormones. In order to lose weight and keep it off, we have to have balanced hormones. And what keeps our hormones out of balance? It's toxins. And where do toxins come from? They come from many places, but one of the big things they come from is the environment. The things that we're breathing, the air that we're breathing. You can see here on this PowerPoint slide the smokestacks, and we have them in all of our cities. The water is increasingly toxic. Think about Flint, Michigan. they had so much lead that had built up in their water system. We do have water system issues in all of our metropolitan cities in the US. And it's important for us to make sure we drink clean water, that we eat food that's as clean as possibly can, as we possibly can. But generally, we are living in this toxic environment. And so that's going to get into our bodies. And that's also some of the things that we need to help our bodies get rid of. Here's one you all are going to love. Clearly, we know the saying, we are what we eat. But here's what we eat. Here's what is the standard American diet with the acronym of SAD. And if I look at this, I see these are what kids are eating every day. This is what my patients come in eating. Cereals for breakfast, fruity, sugary cereals, lots of pastas and breads. It's easy to eat carbs. And it's easy for us to turn on carbs as the evil. But if we look at what makes up most of our diets, if we were to just eat whatever, it's easy to eat carbs. They taste good. They go down easy. They give us lots of quick burn energy. But at the end of the day, they don't last very long. And these are the things that are building up in our tissues and in our body. This is the building blocks that we're feeding ourselves if this is the type of foods that we eat. Coke, other soft drinks, pizzas, fried foods, they damage the liver. They damage the very thing that we need to remove toxins. So if you look at this list and you see some of your favorite things, then what you see are some of the things that are probably contributing to your health issues. So how do we deal with toxins? What does our body do with this toxic load that we get? When we are forced to deal with the toxins in our bodies, such as food additives and chemicals, we have three choices. We can bury them in the fat tissue, we can deposit them in other tissues, or we can remove them. So the long-term ingestion of low-level toxins may lead to what we can term disease. So let me say that again, because it's very difficult for us to kind of think about where these toxins go. So when we eat them, a lot of times we think, well, we just eat them and they leave. Well, they don't leave. A lot of times these things are residuals that build up in what we call a toxic load, a toxic burden. It's building up in our cells and it's cumulative and it happens over time. So all these toxins from food, from water, from the environment are building up in our system, and our body will often bury them in fat. And here is one of the things that keeps us from losing weight, right? Because our body is actually here to protect us. So it's going to do everything it can to keep us safe. And here's a picture of, it's a very simplistic picture, and our liver does not look like this, but I kind of give you this little filter system so you can kind of get an idea of what happens when our liver's working well and when its ability to eliminate toxins is high. So we have a toxin. Phase 1 elimination would be like getting your garbage ready for pickup. So it's like you put all that garbage in the trash can, you get it bagged up. That's what the liver's doing when those toxins hit. It's getting it ready to be released. Then what happens in phase 2 is this toxic, garbage needs to get out. And so phase 2 allows us to be able to make that toxin less toxic so that it can be removed through our normal elimination system, which is through the urine and through the stool. And so consider in phase 2 that if the garbage can't get picked up, you can imagine if you had all those garbage bags building up at your house, that's what's happening inside your body if your liver's not working. So does that make sense? We've got phase 1, your body's grabbing the toxins that are coming through, and this can be drugs, alcohol, any kind of medications, toxins found in foods, heavy metals, all these things, all of them go through the liver. So phase 1 is packaging them up. Phase 2 is getting them out. So if we have a problem or a breakdown in either phase of this liver detoxification, we are going to have problems, and we're going to have problems in the body, and the toxic buildup is going to be a lot more severe. So if we look at what the causes of these things and what the effect, I guess, of these things are on the body and the population at large, we can see that obesity trends are on the rise. We have numbers here from 85, 95, 2005, and 2014. And you can see that our country is just getting fatter and fatter and fatter. And Georgia's in there. We're at the darker red color. So we're at greater than 20%, and that was in 2014, and that's 6 years later. So I wonder what those current statistics are, which I don't have for this particular PowerPoint, but it gives you the idea of how our bodies are really having trouble. So why doesn't our weight stay off? Why do we have such trouble with it? Why are there issues? So now there are lots of reasons why we can't lose weight. But one of the ways that the liver deals with this is to increase our body fat, to enfold and hang on to these impurities and to keep them away from our organs. So diets are not extremely successful for long-term weight loss. I have a patient came in this week and said, can I just have a appetite suppressant? Is there anything that would just help me get the weight off? And you know, there's so many things that go through my mind when someone asks me that, because this is a multi-layered question. This isn't just when you go to a quote weight loss clinic and they just give you weight loss things. They're forcing the body to do certain things. They're stimulating a body that may have weaknesses and struggles and stresses that cannot be easily fixed. So if we look at a traditional diet, when someone's going to, like, say, just reduce calories significantly, our fat is there to protect us from all these impurities. So if you see this little guy over here, we've got more fat and the impurities are kind of hanging out in there. Traditional diet, smaller body, means that if those impurities are still there, we lose that fat, and now all the impurities are actually in the body. And the body senses that, gets pretty freaked out, and goes into emergency mode and puts the fat back on. Right? So that could be you, that could be me, that could be anybody who's struggled and struggled and struggled and lost weight and then put it right back on. Sometimes we have to take the steps to go through to help the body to actually balance itself properly. So if we look at cleansing and replenishing the body, we see the fat it's protecting us, it's keeping this away. So what would happen if we actually took step one and helped remove some of these excess impurities, give the body the ability to get these excess things out? Then we'll lose the weight. The body's not scared about all of these crazy impurities floating around, and we're able to keep that weight off a lot more successfully. One of my patients wrote a success story this last week about how she's actually maintaining her weight at 72 years old better than she did when she was 18 or 20 years old, because she's been my patient for several years, and we have worked diligently to change her diet to get these impurities out, and she's doing great. And it doesn't take years to do that. But what I'm saying is she's developed a habit, a long-term habit, where she is eating well, and she's done a detox almost every year. Do you see what I'm saying? So it's also cumulative. When you get rid of these guys, you get rid of these impurities, that builds up too, and it increases your level of health. Let's save the liver and also the stomach and all the rest of our body parts. So the body's designed to cleanse itself. Our detoxification system is adaptable. It's capable of handling a great many toxins. When your liver's not overwhelmed, your body is much healthier and happier. We really do want to do as many actions as we can to cause our body's own elimination system, like the bowels, like the kidneys, like the liver, to just intensify and improve on their detoxification abilities. Then we have better function. When your system's overwhelmed, that doesn't happen. And when the system is overwhelmed and we can't get rid of toxins, we have acute illnesses, we have chronic illnesses, and the difference between those is just short-term illnesses that you have and then long-term illnesses that have been with you for quite a long time. When we have damaged DNA, which can happen as a result of increased toxicity levels in the body, that can be carcinogenic. So getting these toxins into our brain, the nervous system, can cause all kinds of issues with our cognitive function, memory loss, brain fog, general poor health. We can have issues with inability to control weight, and obviously hundreds of other problems. Doing this detoxification and maximizing the liver's ability to function better will really help our body with cholesterol management. I did want to point out some of these tests that we did pre and post. So here is Tom. He started the program, his cholesterol was 263. And if you guys know much about the cholesterol numbers, we want our cholesterol levels below 200, ideally, right? Like 189, that's a good thing, 179. And his is up at 263. His triglycerides are 181, and those are way too high. And his LDL is at 174. And the cutoff for LDL, which is the bad cholesterol, is like 99. So triglycerides are a type of fat that's found in your blood. It's bound in your blood and it circulates and the body uses it for energy. You do need some triglycerides, but too many of them can raise your risk of heart disease and can be a sign of metabolic syndrome, which is a huge risk factor for heart attacks. So if you've got high cholesterol, high blood pressure, high triglycerides, and possibly high sugar, you are in the biggest risk category for developing heart disease, for developing heart attacks. And that is not the way you want to go, because in many, many cases, you can reduce all of those risks by our diet changes and by our lifestyle. And so he did this program. And as you can see, when we started, here was the before, 263, 181, 174. After, so he chose to do this detox long term. So we have July, August, September, and not even that long, but he did 2 months of it. And look at this, changing this guy's diet, helping his body be more effective at detoxification and all of his elimination system working better. Look at that cholesterol, 178, triglycerides down to 107, and his LDL down to 107. That's a huge change, huge. So these are things that can happen, and many of my patients have high triglycerides, high cholesterol, and too high of that bad cholesterol. So this is a way that we actually can enable our bodies to heal themselves, right? Which is what we're after. Here's another lady who did this program, and this was just a month for her. So this is what we're doing together as a group now, is the detox for 30 days. So here we have cholesterol 344, extremely not good. Triglycerides at 787, that's absolutely out of this world crazy. And then her heart risk is percentage-wise, 7.2, which is a really high percentage. With women, you want that to be between 2.5 and 3.5, and hers is 7.2. So she changed her diet drastically, and it's quite impressive. We have that cholesterol went from 344 to 182. Her triglycerides went from 787 to 108, and her heart risk percent went down to 3.7. And I have patients ask me all the time, do I have to take medications to fix my cholesterol? Do I have to take these things to fix it? And I tell them that in many, many cases, let's give diet a shot. Let's change some lifestyle things. Let's make an effort to give the body what it needs to actually be as healthy as possible. And I have these changes all the time here at the clinic when people actually get serious and change their lifestyles for the long term. And that kind of puts us at this point, is what are your goals? What do you hope to gain from doing this? This might be a good time to jot this down on a piece of paper, or in your phone, or wherever you keep your thoughts, and look at these things and ask yourself, I have my patients give me a why. Why do you want to be healthier? Why would you want to go through the trouble of changing your diet? This isn't always easy. This is sometimes the most difficult things that my patients have to do, is changing their diets, change their lifestyles. Why is it important to you? What is your why? I can tell you mine. Mine is, I want to make these changes to my life and my lifestyle long term, because I want to be here for a really long time. I want to be here to enjoy my grandkids. I want to have good health. I want to be active. I want to be able to do things I want to do. I want to travel. I want to be able to move. I want to move without pain. I want to, be active for as long as I want to, as long as the time that I, can choose to do these things. That's what I want. It's a good quality of life. And so what are your goals? What's most important to you? What do you want to achieve? And it's like all of these things can add up to you really understanding yourself and why you want to be healthy. And it will also help you when you're tempted to eat some more things that maybe aren't on your diet, or to not be moderate, to go crazy a little bit, or to even fall back into old habits. They say that it takes 2 weeks to make a habit. And I've seen that it takes a good 30 days to a month to make it into a lifestyle. So I'm hoping that during this 28, 30-day program, over this next month, you're going to make some really healthy lifestyle choices. And I really would encourage you to come up with your why. Why do you want to be healthy? Why do you want to make the changes that you need in order to endeavor to live a healthier life and be healthier? With that, when you are tempted to eat crazy things or things that aren't healthy, you can stop and go, why do I want to do this? And for some of you guys and some of the patients I work with, you have some pretty severe issues. You have diabetes, heart disease, all the metabolic syndrome that I was talking about, high cholesterol, high blood sugar, high blood pressure. All together, if we don't do this long term, if this isn't a lifestyle, where you're going health-wise is not where you want to be. And all these pictures of in my head, as I look back over 27 years of working with patients, in seeing the patients who make the decisions and who change and the patients who don't, and having been in practice this long, I see the good and I see the not so good. And I see where uncontrolled diabetes leads people. I see people all the time in kidney failure. You do not want to be down that road. You don't want to do dialysis. You do not want to be in a situation where your cholesterol is out of control. And the good thing is that if we have made choices that put us in this situation, the great thing is we can make choices that get us out. And I'm here to encourage you. And I tell my patients, I am not here to yell at you or to be the food police. I'm here to be your biggest advocate for making those choices for yourself so that you can have a long and healthy life and do the things you want to do. So I would like to introduce the SP Detox Balance program for you and to you, and help you to get to know, like, what is this whole body detoxification? We are not going to force toxins out of those tissues into your body. All we're going to do, and what we're going to do, which is most effective, which is easy, safe, and healthy, is to promote the body's own ability to detox itself, which it does every single day. That's what your liver does. That's its job. That's what it's put here to do, is to detox. Your colon moves the toxins out. Your kidneys move the toxins out. All day they do that. So what we're going to do is maximize your body's natural metabolic detoxification process and just make it better and give the body nutrients that it needs to regenerate and to heal possibly areas of the liver and other areas of the digestive system that have been stressed or damaged, and give it what it needs to help be better. So the SP Detox Balance is the smoothie that you're going to take every day in increasing quantities that gives the body what it needs to basically heal. And it's going to support the natural metabolic detoxification process. And it's very easy to use. So all the detox is in it. So there's no taking tons of pills. We used to have a detox years ago that consisted of smoothies plus 800 million pills, which that wasn't the most fun, and it worked great, but it wasn't fun. So everything now is actually in here. So the SP Detox Balance is pea protein. It's got flax meal. It's got sweet potatoes. There are some oats, pumpkin seeds, buckwheat, carrot, Spanish buckwheat radish, and apple pectin. And so I want you guys to also take a look at any of these. And I have some patients who I'm working with who do have some sensitivities. And if you do have sensitivities or allergens to any of these things, I do have a alternate workout that we're going to do that will enable you to be just as effective and just as successful, but we would just use a couple of different things to help you not cause more inflammation by taking in your allergens. But for those of you who can do this, basically this is going to be a 28-day comprehensive program. It's going to consist of, these are the number of shakes that you would do per day. So they give us an example month here. So we've got day 1, 2, 3 is 1 smoothie. Day 2 is moving up to 2 smoothies. And then week 2 is 3 smoothies. So we've got 2 weeks of 3 smoothies a day. And we're going to fit in food. So this isn't just smoothies only. We actually are going to do some really good, healthy food too. So you've heard of alkaline and acidic, and that's another whole workshop in and of itself. But what we do know is that we want the body to have a lot of alkalinity, not in the stomach, but in the rest of the system. So the foods that you eat can affect this. So on this detox balance, on this diet regimen with the smoothies, we're providing the body with things that are rich in alkaline minerals and that can lower your body's urinary acidic levels. So we're going to bring the body more into an alkaline state, which is where it can be healthier. So here's how we get started. We'll calculate your protein needs. And if you look at this little chart here, it's based on body weight. So your body weight is here to the left. So we've got anywhere from 110 pounds to 243. And then you can see over to the right how much protein you need. Now, over the last few years, there have been a lot of pretty awesome studies that have come out that actually show, especially as we age, we actually need more protein. And sometimes we read a lot of crazy things, of course, on the internet, because that's what the internet is for. And what I want to help you do is get some truth here about what type of protein you need. And protein is extremely important. It's important for all tissue rebuilding. It's important for everything that takes place in our bodies. And so we need protein. You need to eat protein. The most complete protein comes from animal products. Animal products have complete protein. The SP Detox here has complete proteins because of the combinations that they actually use, but by using a vegetarian protein, we are getting complete protein. But we'll also add some lean protein and lots of vegetables during this detoxification process too. So we will calculate your protein needs. You'll work with me to figure out what your target is, and then we'll log in your shakes, your protein, your water, your exercise, and how you're doing mood-wise, and use the notes section. You get a little book that goes along with this. And as you go through the detoxification, you want to consume enough protein to support your body. Protein supplies those amino acids, which you've probably heard of, but those are the building blocks of protein. They help support the detoxification pathways, and I will help you figure out how much you need. So what does a balanced plate look like? Here's an example. Maybe the diet pyramid that we all learned in school is not so accurate, but if we want to look at a plate, this is what I want you to look at. So we want to have a big majority. It looks like about 50% of our plate needs to be full of beautiful vegetables. 2 to 4 servings daily of your protein, and 5 to 7 servings all day, every day of these greens, right? We do need some healthy carbs. And so here we have some brown rice, but you see that's a very small proportion of that plate. It looks like about a half a cup. And then with fruits, we want to do the low sugar fruits, the low glycemic index fruits, the fruits that don't jack our sugar up crazy high. So berries are some of the lowers, and cherries. So it's like we really want to do 2 to 3 servings of these per day and 5 to 7 servings here. It doesn't take a lot to get a serving of vegetables. About a half a cup equals a serving. Water is extremely important. We all know that. A hydrated body is a happy body. Cells are hydrated when we get enough water. Drink about 8 to 10 glasses of water per day, and each glass should have at least 8 ounces of water. Don't overhydrate. I see people trying to drink 2-3 gallons a day. That can actually cause stress to your kidneys. Drink 8 to 10 glasses a day, and that will keep you hydrated. Another super important thing is movement. Our bodies were made to move, and moving is extremely healthy and extremely important for detoxification. Exercise facilitates the removal of toxins, but it also helps you maintain healthy weight. So 30 to 45 minutes of exercise every day. If you can target 10,000 steps, that's sometimes really helpful for me. I can look at my watch and see, okay, I need, 343 steps or 1,000 steps, and I can get moving. So it's really important. Sedentary lifestyle is the new smoking. I've heard that said. So being sedentary can be very, very, very unhealthy for our heart health. So get moving. I don't want for you guys who have possible issues with your body and you haven't been exercising regularly to get out there like these guys, and it looks like they're running, 3 miles. Just walking for a few minutes every day. And if you have any questions about the safety of that, please consult a medical provider or talk to me and we can sort that out. But exercise, just movement, doing some type of movement, 30 to 45 minutes of exercise per day actually enables us to actually live a longer life and healthy life by study. Let me show you a few sample meals here. You will get this in your kit here. So we've got sample meals. So this could be a 1 shake day, right? So we've got breakfast, you have gluten-free pancakes, which you have recipes, turkey chili, chicken piccata, you have some snacks in here, and you can do your smoothie either as a breakfast sub, or you can do it in between. Those of you who are working with me on diet, track your food. I really, 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 really recommend tracking your food on some type of an app. The unobserved diet is sometimes not even worth eating because you don't even know what you're eating, especially with weight loss. I have patients who so often will come to me and say, I'm eating great, why can't I lose weight? And we'll track their diet for a week to 2 weeks and realize many things. One woman was doing a paleo diet and came and said to me, all I eat is protein and vegetables, I should be losing weight. Well, what we found out was she was eating 3 times the amount of protein that she should have been eating. So many more calories, her body couldn't burn them fast enough. Other patients, the extreme opposite. I have patients who should be eating a 1,500 calorie a day diet, and we're eating 900 calories, 800 calories. Contrary to common belief, if you do that, your body's alive. It can track that it thinks that it's starving, and it will slow down. So it is sometimes not intuitive to think to eat to lose weight, but you have to eat to lose weight. You have to eat food because it will keep your metabolism moving. The less food, the slower the metabolism. So get with me if you have any questions about calories, and let's track. So some of my favorite apps is MyFitnessPal and Lose It. I like Lose It a lot. That's the one that I use personally, but I used MyFitnessPal for years. And it's helpful to track this so you can actually see what you're eating. And we cannot overeat and we cannot undereat. So this gives you an idea of what a one smoothie day looks like, or a 2 smoothie day. Here's some plates that I put together with some real food that you guys can actually look at. These actually do make me happy. So say, for example, I would do a smoothie as my protein in this particular situation. And then we've got sauteed broccoli with garlic and red pepper flakes. You can make it taste good. You don't need to make it taste bad. Like, there are also services out there that would enable you to bring in some metabolically healthy meals that you can just put in your freezer, that just clean protein and some veggies. And you can just buy some of these things at the market and just spice them up a little bit. We have sauteed broccoli with garlic and red pepper flakes. We've got roasted sweet potato fries, some sliced cucumbers, roasted butternut squash hummus, and some zucchini spaghetti with romesco sauce. That beautiful romesco sauce can be put on anything and it tastes good. Sauteed broccoli with raw beet and carrot salad, yum. Roasted butternut squash hummus. So if there's any of these things that sound good to you, you can make them and you can have them on this diet. But you can see how it can be creative and it can be tasty. Here are some more plates that I really like. Sauteed spinach and beet greens. Beet greens, if you've never had them, are amazing. So you can buy the beets with the greens and have the beets and the greens. Roasted butternut squash hummus, some Indian spice roasted cauliflower. You can make little sauces that have olive oil in, that you can put on there. You've got right here, you see a 1/4 cup of curried lentils. So you can make some lentils with curry, some garlic powder. Indian spice roasted cauliflower, romaine salad with hard-boiled egg. This can be a beautiful lunch for you on this diet or on this detox. So let's talk about a little bit about what you will not be eating. Of course, we have to cover that. That slide that we saw early on is the things we want to stay away from. What I will not be eating on this detox, what we want to do is keep the bad stuff out, put the good stuff in. When we do that, the body will automatically detoxify itself. So we want to get rid of breads and pastas. Many people, myself included, have a sensitivity to gluten. A lot of times, and again, that's a workshop of its own too, but breads and grains are inflammatory. Breads and grains can cause weight gain. Most of us eat too many carbs. So getting the bread and pasta out, getting the candy and refined sugars out, all those highly processed foods that you see in the store, all down those aisles, stay on the outside of the grocery store and eat the produce, eat the meats, eat those foods that are not processed. We do not want to eat artificial sweeteners. Splenda is an artificial sweetener. It's it's bleached sugar. You do not want that. Equal, sweet and low, not good for your body, have shown to be actually carcinogenic. Diet soda is not good. Caffeine, green tea is okay. Sodas and alcohol also out. So we're not doing alcohol this week. So it's what, dry January? So it's good, you know, it's good to do that, especially after maybe having eaten too much and abused our bodies a bit over the holidays. So those are the things we're getting out. Now, caffeine, some people will kind of have a little freak out. If you want to do 1 cup of coffee a day, I am okay with that. I'm not here to have people have headaches and feel sick. And some people really do have an addiction to coffee. If you're the kind of person that drinks coffee all day, what I recommend is slowly weaning off caffeine a bit. Just don't go cold turkey because you can have a really hard time. Green tea in the morning is good, and have 1 cup of coffee. If that will help you, have 1 cup of coffee. You can use a dairy substitute, maybe almond milk, nut pods, and a better half are some really good that I use if I am having coffee in the morning to avoid the dairy. And here's a success story from one of my patients who did this. This was my 5th time to do the detox program. I feel the best I have ever felt. I lost weight in the place I needed it the most, in my waist. I got back into a great sleeping pattern. I feel re-energized. The most surprising thing for me is the change in my morning routine. I used to drag myself out of bed. This was the patient I was talking about earlier. 7:15 for a 7:35 departure. I would have 0 energy. My brain was foggy. Half the time I would forget the important things and start off the day grumpy. On day 5 of my detox, the body started waking up at 6:50 with a clear mind and energy, no alarm clock. That extra 25 minutes of quality time allowed me to eat breakfast, enjoy a cup of green tea. I don't feel rushed. I walk out the door relaxed. That in and of itself is worth gold to me. It's pretty awesome, right? So that's one of my patients who did this detox. I want to inform you of how my life has changed since the detox. You told me it would, but I was skeptical at best. I was at a point where I felt like I had no life. I was exhausted, constantly in pain, depressed because I couldn't lose weight. I was taking handfuls of extra strength Tylenol and Excedrin every single week because my joints hurt so badly. That all changed the first week I was on this detox. I slept soundly through the night. My ankles and hands stopped swelling. My headaches went away and I had unbelievable energy. I now come home from work, cook dinner, am actively involved with extracurricular activities. How about that? Having energy to do stuff like at the end of the day. I exercise, I don't take pain medication, and I've started to lose weight. I have continued this healthy lifestyle and I feel better than I have in 10 years. Thank you for the opportunity to feel great and live my life again. And that is what we are here to do, is to help you be as good a you as possible, to have what you want, to have the health that you want, to have the quality of life that you want, to do the things you want to do. Like, who wants to take handfuls of Tylenol and feel horrible every day, right? You can have this too with a little bit of work and a little bit of change. So thank you so much for being here. This is one of my favorite quotes. Everyone has a doctor in him or her. We just have to help it in its work. The natural healing force within each one of us is the greatest force in getting well. Our food should be our medicine, and our medicine should be our food. And this is Hippocrates. So let's let food be our medicine this month. Let's help our bodies be as toxin-free as possible. So let's get started. To receive your detox kit, call us, email us. You can talk to us now, chat now, and let us know what you want. We will ship it to you. You can come pick it up. Shipping is free. And if you're new to us and you need help with your health, please schedule an initial appointment. I will give you $100 off your initial visit. We can get down to the bottom of what is actually going on and help you get the health and the quality of life. This has been my profession for 27 years, and I am grateful and so happy that I am able to help so many people in this way. So I hope I can help you too. And those of you guys who are my patients, you'll love the detox. Let's get started and get you better. So you can take a picture of this slide if you want to, or save it. These are some resources that I have found to be really helpful to folks as they're trying to lead a healthier life. The New Whole Food Encyclopedia by Rebecca Wood, Nourishing Traditions by Sally Fallon, Empty Harvest by Bernard Jensen and Mark Anderson. And then Weston A. Price website has a wonderful plethora of information about diet, dispelling the myths of fat, and that good fats and what we need to eat good fats, and it giving to us a lot of good information about how to get cholesterol down. and then going back to the basics of human health by Mary Frost. Here's our number again, 770-937-9200, and you can email us at patientservices@alternativehealthatlanta.com. So thank you so very much for being here. I look forward to answering any and all of your questions at our question and answer time. So please stay on. If you have questions, please contact us via the chat or call us right now. And we are here at the office, so you can call the office now and email us. Currently, we will be able to pick up your emails and your calls now. After the workshop, we are all here and ready to help you. So again, have a wonderful detox, and I hope that you gain everything that you want health-wise, and I'm happy to be here to help. So have a wonderful time, and we'll be here to answer questions. Thank you.